getting back to the heart, we kind of want to make our muscles big, but we don't want our heart muscle to be big.
Huh, why is
That's a
that?
bad thing. Well, it doesn't use oxygen efficiently. It actually, if it gets really big, it doesn't pump blood efficiently.
So bigger is not better.
Bigger is not better for the heart muscle. And that's one of the consequences of blood pressure. In fact, let me just go over the general bad things that happen to people with uncontrolled hypertension.
I wish you would, and I want to mention this statistic. I was horrified or surprised that apparently up to half of our population has high blood pressure.
Yeah, and if you...
Oh, my goodness, half. That is enormous.
Over 65, it's 2/3.
After age 65, 2/3 of us have high blood pressure.
So there's good job security if you're a hypertension guy.
Oh, my goodness. That's up there with HVAC. Everybody needs it.
Yeah. At any rate, as far as what happens to people, bad things that happen to people with high blood pressure that's not treated.
All right, give me the bad news.
Well, basically, it damages blood vessels, and there's 3 categories of problems. Number 1, kidney problems. Your kidneys are made up of little balls called glomeruli of small blood vessels, and the hypertension can damage those, and you can end up with kidney failure.
Oof.
Next thing is stroke. You can have buildup of plaque in your arteries going to your brain, or you can have enough hypertension that you can actually have a bleed in your brain.
You actually burst a vessel.
Yeah.
Bad place to have a bleed.
And then heart disease, heart attacks, and congestive heart failure.
Because of damage to the arteries and the of that feed the heart from this high blood pressure.
Heart failure is caused by weakening of the muscle of the heart, which can be from heart attacks, where you lose the arterial support to the heart, or just the effect of blood pressure on the heart over the years. So, at any rate, those are all things we try to mitigate, and hypertension is one of the most powerful things you can manipulate to reduce your risk of those things.
This is so important. I'm so glad we're talking about this subject. So, what is the usual cause of high blood pressure if it's so prevalent?
Well, you got me there. We call it essential hypertension. And essential just means, we don't really know why people have high. We have ideas. It has to do probably with our lifestyle and what we eat and our activity or lack thereof.
And genetics at all? Does it run in families?
It does.
Essential hypertension?
And there are different flavors of hypertension. People sometimes can be very salt sensitive. In other words, their blood pressure goes up dramatically with sodium.
I want to get into that. That's a very, very important.
Not so much. Yeah.
That's a very important topic. So most of the blood pressure problems are essential or primary, and people just seem to develop it. We don't always know the reason. And that's the majority of high blood pressure?
The majority. But we do know that if we control the high blood pressure, we prevent many bad things from happening.
Down the line.
Now, there are some secondary causes. I can just go through briefly, but you see them generally, rarely. Having a blockage in one or both of your arteries to your kidney can cause high blood pressure because, as you mentioned, the kidney is the sort of mastermind behind most of the factors of blood pressure: vascular tone and salt and water, everything but the cardiac output. And if the kidney thinks your blood pressure is low because the arterial supply is reduced, then it puts out hormones to drive your pressure up. It's called renovascular hypertension. There's also hormones that come from your adrenal gland.
Now, that's the gland that sits above the renal, and renal's part of the name, adrenal. And you've got to know about those too, don't you?
Yeah, but they're completely different than the kidney, but they're very important in blood pressure control.
And they're next to each other probably because they have to communicate.
I don't know why they're next to each other, but perhaps. But aldosterone is a hormone that causes us to retain salt and can regulate blood pressure. And sometimes we can get a benign growth in our adrenal gland that puts out too much aldosterone. And that's another secondary cause of hypertension. One of the commonest treatable secondary causes of hypertension is sleep apnea. It seems like everybody in the world has sleep apnea.
Sleep apnea. How does that affect your blood pressure, Keller?
Well, it puts a massive stress on your body because you don't sleep very well. You have these little alert. You don't have the nice sort of deep sustaining cycles of REM sleep. You have these little bursts of alertness all the time. That's associated with obesity, which is a popular condition in our country.
Also over half of us. Wow, very, very common. So there's the slow, chronic high blood pressure, and then there's these kind of sudden, or all of a sudden your blood pressure was fine, and then it's gone up acutely, and that's the sign of one of these secondary problems,
it can
perhaps.
Be, There's also a rarer kind of problem from the adrenal gland where you have a tumor that puts out adrenaline or epinephrine, norepinephrine, called a pheochromocytoma.
Very rare, but very serious when they happen.
My first day in the hypertension clinic at the Mayo Clinic, we saw 6.
Whoa!
That's just one of the benefits
that's more than
of
some
being
people
there.
see in a career.
That's about how many I've seen in 40 years here.
But as a fellow, they all get funneled in.
They get shipped from all over the world.
They get shipped, yeah.
But that's just an example of how cool it is up there.
And what kind of training you had. Oh, my goodness.